The STP is a new way of planning in the NHS with the local authority. So there are 44 areas in the country. Humber, Coast and Vale covers about 20 organisations, and that covers 6 local authorities, 6 CCGs and a number of provider organisations, and the aim is that we all work together to improve the health and wellbeing of the population. The population of Humber, Coast and Vale is 1.4 million. 23% of that population live in some of the most deprived areas in the country, but the good thing about working together is it actually allows us to sort of learn about how we can try and improve the health and wellbeing of our population.
The STP Finance Group was sort of an emerging group as part of the development of the STP. It brought together the finance leaders across the Humber, Coast and Vale, and essentially what I've been doing is leading that group, meeting on a weekly basis, going through some really sort of difficult suggestions and proposals around how we manage the money differently. By coming together we can get that understanding and think about doing things really differently so that we make the best value of every pound that we spend.
The Children's Health and Wellbeing Transformation Board's been in existence probably for about 5 years now. It's a strategic level board that has a remit around transformation and redesign of services to improve children, young people and families' health and wellbeing. We have a work stream that is specifically focusing on the transformation of emotional wellbeing and mental health services. I've worked in Sheffield for a long time now, and I think there's nothing greater than seeing healthy children and young people. What I do in my public health role is try and have a population level impact so that it has the greatest impact on all children's health and wellbeing.
Some of the programme areas: developing and supporting services for children with complex needs. Maternity and Best Start, where we're basically delivering better births, providing more choice and control about the services for women. I think in the current climate, transformation across health and social care is inevitable, and getting everybody on board in terms of what that service transformation is and supporting improved outcomes for child health is really important. We really need to ensure that every child in Sheffield has the best possible start in life, so ensuring that we engage everybody in that service transformation is critical to improving child health outcomes.
The Health Coaching Steering Group initially started off with 4 of us essentially that were really interested about what it was that we needed to change in the system, with having better conversations with patients really.
The actual health coaching in terms of the training is a 2-day course that we deliver. The model that we're taking in terms of health coaching is taking 3 lots of skills together. So it's around taking coaching skills in terms of having open conversations in terms of starting with what matters to the person. It's about taking motivational psychology kind of skills in terms of motivating that person, and also though feeding in your own knowledge and skills as a healthcare practitioner. So it's the combination of all of that that's really the health coaching conversation. So the House of Care is a national model around supporting self-management and people with long-term conditions, and it's a metaphor. So it's got 2 walls, it's got a roof and it's got a foundation. If you don't have the walls, it's going to fall down. If you don't have a roof, it's going to leak. So on one wall is all around supporting people to have the confidence, capability, skills to manage their condition. And then the other side is around health and care professionals. Again, having that culture, having that mindset and having the skills to have a better conversation.
From a patient's perspective, it's absolutely about treating them not just as a patient but actually as a human being, and having, as it says on the tin, a better conversation with them. So what is it that they want to get out of their care? We're doing this because actually we know it really does make a big difference to patients, and if we can make our staff feel happier and developed in being able to do this stuff, then that's absolutely the right thing to do.